Hi, Lee. Thanks for joining us today. Today we are covering some changes that have been released regarding Medicare and then focusing on Medicare Advantage. In our previous discussions, we talked about basic Medicare and then Medigap or supplemental policies, but we haven't quite touched on Medicare Advantage yet. So I'll turn it over to Lee to get us started.
Hi there, and thanks for having me today. So we want to talk about Medicare in general first, and then we're going to bring it down to Medicare Advantage plans, okay? So across the country, there are 69 million Americans on Medicare in general. And of that, 52 to 54%, or about 37 million, are on Medicare Advantage plans. So what happened to the rest of those people? Well, those other 32 million are either on original Medicare with no supplements, or they're on supplements with original Medicare. So everybody who's on Medicare has some sort of coverage for the rest of their life, one way or the other. One of the things that we want to talk about today is that there are a few things happening in the Medicare market in general. Costs are increasing, and there are more people every day getting care than there have been. All those baby boomers that have now turned 65 or are in the process of turning 65 are hitting the Medicare program. And so costs are going up and up and up, not just because of inflation, but because there's so many more people accessing care in the system. Last time, I think we talked about the fact that here in the state of Texas, we were going to be piloting a program for people on Medicare Supplement Plans, where they may now have to get prior authorization for certain procedures, 6 different certain procedures. So those are just starts of what we're going to see in terms of trying to contain the cost for the insurance companies. When we talk about Medicare in general, there are 6 categories that we try to focus in on. Number 1 is the premiums. Number 2 are other perks that you get. Number 3 would be networks. Number 4 would be, what about other coverages you get? So that'd be like your dental, your vision, anything extra. Cost sharing. So in other words, is that a fixed copay, or is it a percentage of the insurance company's paying and you're paying the other portion of percentage? And then also plan administration. And when you think of plan administration, you have to think of a lot of different things. So when you think of a group plan, do you have to get prior authorization for surgery? Do you have to go to a network? Do you have to worry about how your claim is going to be processed? And if the doctor puts the wrong code on it, how does that work for you to get your claim corrected? All of those things happen kind of simultaneously, and we don't really see it in a group plan because there's somebody in the HR department or somewhere else that's taking care of those issues and helping us and guiding us through that maze, if you will. When you're in Medicare, you're the one that's guiding yourself through that maze of how do I maneuver getting this claim paid correctly, because it should have been paid this way, but it was paid that way. So you kind of have to understand and know more about how your claim works behind the scenes, and that's why it's so important that people look at their explanation of benefits, whether they're on a group health plan or in an individual plan or in Medicare, because that's going to show you exactly how the insurance company paid that claim. It's going to tell you how much of a discount you got. It's going to tell you how much the plan paid, and then what you may have to pay, or what is left that could be balance billed. So I'd like to focus in on a couple of those things today. First of all, with the premiums, Medicare Advantage plans usually have a 0 premium, meaning you don't pay anything month to month. You just pay your Part B costs from Medicare. And if you're already on Social Security, that's coming out of your Social Security benefit automatically for you. If you're not yet on Social Security, you've got to figure out a way to pay that. You can either write a check quarterly to CMS, Centers for Medicare and Medicaid Services, or you can let them come into your bank account and deduct the cost of Part B each month from your bank account. The choice is yours. Some people don't want the government coming into their bank account for whatever reason. Totally understand that. Then you have to be prepared to write a quarterly check, because they will not accept a check every month. It has to be paid quarterly if you're going to send a check in. Other perks, Medicare Advantage plan leads the way with all of these other things like gym memberships, over-the-counter cards so that you can buy your vitamins, your minerals, you can buy Band-Aids, anything that will help you with health and wellness. And even if you do get sick, over-the-counter stuff, cough drops, cough spray, any of those kinds of things are over-the-counter. Networks, that could be a tricky thing. As we get closer to watching what's going on and watching our own healthcare spend, you have to be careful if you're in or out of network. In Medicare Advantage plans, some of them have a very strict network, others have a very open network. It just depends on the plan and the carrier. And the same carrier can offer a very restrictive network, but they can also offer a very free and open plan that has very few restrictions. But there's going to be some trade-offs inside the Medicare Advantage plans. So you have to look at each plan very carefully. Other coverage, like I mentioned before, that could be dental, vision, could be, do they provide a hospital program, or if you go into the hospital, are they going to help you with any of your per day copays, any of those kinds of extra coverages. Cost sharing, so that would be, is it a fixed dollar payment that you make when you go to the doctor? Is it a $25 copay? Is it a $35 copay? What about when you have an MRI? Is it a $400 copay, or is it a $200 copay? Or is it a percentage of that cost? So if that cost is $500 and you have to pay 20%, okay. Or is it a flat dollar amount? Those are the kinds of things you need to pay attention and be aware of, because when you're paying a percentage, you're paying the percentage that they're billing. So there's no discount included in that percentage. So if it's a $1,000 or $1,200 procedure and the insurance company discount cuts that down to $1,000 or $800, you're paying your percentage on that $1,000 or $1,200, not the discounted price. So it's very important that you realize and understand what you could be paying, whether it's a percentage or a fixed dollar amount. And then the last thing we were talking about again was how the plan's administered. How does that plan and that claim get paid? And is it paid correctly? It's very important that you keep an eye out for your EOBs. A lot of times I get calls from clients and they say, well, I just got a bill from my provider or my doctor and it's some ungodly amount. Well, have you seen, has the insurance company paid on it? I don't know, it doesn't show anything on their bill. Well, wait until you get the explanation of benefits, because the explanation of benefits really tells you what you're going to have to pay, not really what the provider's billing, because the provider can bill you $1,000, but because of their discounts with the carrier that you're enrolled in, your plan may only mean you have to pay $500, but the plan pays 90% of that $500. And so therefore you'd pay $50 or 10%. Okay? So once again, it's very important to look at all the details. So why are insurance companies doing all of these things? And what's going on? As we said before, there are many, many more people hitting the Medicare network and hitting the Medicare program for care than there ever has been before. Not to mention the fact that we have inflation. And then also in 2025, the Inflation Reduction Act shifted more of the drug costs to the insurance company. If you can think back to when you used to have the donut hole, and people were concerned about being in the donut hole because that was essentially $8,000 that the individual or the insured person had to pay for medications. And now that donut hole has gone away, but all of that $8,000 has shifted away from the person to the insurance carrier. And so now that's another chunk of expense that the insurance company now has to burden and figure out how they're going to cover. Enough doom and gloom. Let's go ahead and talk about Advantage plans. You can have a preferred provider organization or a PPO plan. They offer more flexibility. You do have in and out of network benefits. Granted, when you go out of network, you are going to pay more, just like on your group health plan. But you still have the option to go out of network and have some benefits. And then also there's fewer cost containment structures around a PPO plan, meaning you may not have to have prior authorization, or you may not have to have a procedure approved before you have it done. There's also HMO plans, or health maintenance organizations, and these have a little less flexibility. They have no out-of-network benefits. So in other words, you must see a doctor connected with that group. So for example, Memorial Hermann offers some great Medicare Advantage plans. They have some PPO and some HMO. The HMO, you must see a Memorial Hermann doctor and go to a Memorial Hermann facility. Similarly, we have Kelsey here, Kelsey Siebold in this Houston market area. And on Kelsey, you must see Kelsey doctors. You don't have to have a referral, but you do have to see a Kelsey specialist if you want to have some sort of specialist work done. And you also have to go to facilities that are in network for Kelsey. So that would be St. Luke's Hospital. So you can't go to Methodist. You can't go to MD Anderson. You have to stay within their networks. Okay?
And comparatively, the supplements we talked about in a previous discussion, there were no networks.
That's correct.
Okay.
A supplement does not have a network. The only thing you have to check is to make sure that the provider takes Medicare.
Okay.
If they'll take Medicare, they'll take your supplement. Okay.
Just real quick too, looking at the PPO versus the HMO, just when you were kind of going through the differences between the two, it almost seems like the PPO is better in just about every way. So I would imagine anyone picking an HMO is strictly for cost reasons because it's cheaper.
Correct.
Okay, that's probably the only reason someone would pick it ever.
That's correct.
Okay.
Because it is more cost effective for you and for the insurance carrier.
Got it.
Okay. So let's talk about how Medicare Advantage plans really work. When you sign up for a Medicare Advantage plan, you're essentially saying to CMS, also known as the federal government in this case, hey, I'm going to give up my right to go anywhere I want because I'm going to go to a Medicare Advantage plan. And so now you're jumping off, essentially, of Medicare, and the government is going to pay whatever insurance company you sign up with a chunk of money every month for your enrollment. And that chunk of money has to cover your cost of care for that insurance company. So let's put some dollars around this. Okay? Let's say you're going to sign up for Medicare Advantage with ABC Company. ABC Company is now going to get $1,000 a month every month for your care. Even though you may not spend $1,000 every month, they're getting $1,000 from the federal government to manage your care. So you still pay that $188 part to your Part B to CMS, but they're turning that around and sending that back to the insurance company, ABC company, that you signed up with. So they're sending money over to that insurance company, ABC, to cover your costs. So ABC has to make sure that your Medicare costs are all covered with that $12,000 each year. If they don't, then they lose money on you. Well, gosh, I'm really healthy. I never go to the doctor. So in that case, the Medicare ABC company is going, yay, we like this person because they don't go to the doctor and we can make money on them. Well, the federal government says, whoa, not so fast. You have to spend 85% of the $12,000 that we send you every year on that person's medical activities. Well, we can't help it that person doesn't go to the doctor if they're ABC company. So they have to do other activities for that person that will allow them more or better care. So in other words, if you take that example with $12,000 for the year, you would have $10,200 that ABC company has to pay out for your care. And that could be in terms of clinical services, going to the doctor, getting CTs, PET scans, whatever, having a surgery. Could also include your medications, improving the quality of outcome and improving the quality of the care you're receiving by the providers, including gym memberships. Maybe you get a free gym membership. Those are those perks that we were talking about before. Maybe they also include some dental coverage. Maybe they also include some vision coverage and allow you $100 or $150 or even $200 to get new glasses. All of those things would come out of that $10,200. The balance, or the $1,800 that's left over, that is ABC Company's administration costs and profit, if you will. And a lot of you are thinking, well, gosh, $10,000, that's a lot of money. I don't spend near that. Well, the insurance company, ABC, is banking on that they're going to have more people that don't spend that much on their care. And therefore, they're going to be okay because they're going to make money. Because they've offered you all of these services, and it's your choice if you participate in them.
So in that situation too, let's talk about the person that's healthy and doesn't need to go to the doctor a lot, whatever, and let's just say they got a gym membership, but let's just say they're not using that $10,200.
That's right.
So what's happening then?
So the insurance company is still getting paid that full amount. Mm-hmm. It doesn't matter. Then they're looking at covering somebody else who's less healthy with the balance.
So they just have to use it, not necessarily on you.
That's right.
Okay.
That's right. So that's kind of the overall picture, is that $10,000 has to be spent for medical services. And they're banking on the fact that they're going to get more healthy people enrolled in their plan than unhealthy people, because the difference is going to be them allowing you more perks on their plans.
It must be a common problem if, from the government's perspective, if they put this cap on there, like they must not be using that money in full. So why aren't we just reducing what we're giving the insurance companies? Why would they not?
That's called the medical loss ratio. Mm-hmm. And the medical loss ratio is set up for everything, regardless of whether it's Medicare, a group, or an individual plan. Mm-hmm. And so that's been set and carved in stone since the early 2000s. Mm-hmm. Okay? So, like I was saying before, the insurance company is banking on the fact that they're going to have, hopefully, a lot of healthy folks on their plan so that they can make more money. and in turn offer more perks on their plans. That's why you see all of these things going on the TV ads. Oh, you can get credit for your electricity bill. You can buy healthy foods. You can buy this at the grocery store. All of those perks are considered medical activities.
Interesting.
Okay? But keep in mind what's going on in the world today. We have more people getting care than ever before. The cost of care is getting more expensive, as well as the donut hole has now kind of been moved over to the insurance companies. So the insurance companies really have a lot on their plate that they have to cover for everybody, whether it's an individual, a group, or Medicare. Okay? If you think about what's going on today, you should have already, if you're on Medicare now, you should have already received what we call an ANOC, or an annual notice of change for your plan. If you haven't gotten it yet, check your mail, check the pile of mail over by the TV or on the kitchen counter, because it's probably in there. This year, in the across the country, there are more than ever plans exiting the marketplace because the cost of care is getting so high, because there's more people getting care, and also because of the drug plan changes, okay? As we said before, PPO plans are less restrictive and they may have a monthly cost. I was checking the other day, and Blue Cross Blue Shield, everybody knows Blue Cross Blue Shield. They offer Medicare Advantage plans. A client of mine says, oh, I'm not real happy with this plan. Can you look at a Blue Cross plan? Absolutely. So I went out to Blue Cross website. They had everything up. The only PPOs they offered started at $92 a month. $92 a month in addition to your Part B. So they started at $92 and they offer 3 PPOs, $92, $114 a month, and $142 a month. Those are the only PPOs they're offering. I have other...
And you seem shocked by that, meaning there was significantly more prior.
Yes.
Okay.
Yes. There used to be at least 12 plans.
Okay.
And now there are 7, maybe 8 that I saw. So there's 3 PPOs, and there's no 0 premium PPOs from Blue Cross. The only thing that is a 0 premium from Blue Cross are the HMO products. Keep in mind, the HMO products are more restrictive and have more cost containment features already built into the system. So that's why those plans are still at a 0 premium.
Is there a requirement to offer a 0 premium option?
No.
Okay.
It just depends on competition. And because here in Houston, we're in a very medically competitive market, that's to a huge benefit. If you were in some rural part of Texas, you might still be paying for an HMO plan, even though it's an HMO and you're going, it's an HMO, I don't want that. You still may have to pay for it. Every state has geographic counties, and so when you look at plans, you have to make sure what county plans are offered in. So, for example, there are 5 areas here that we tend to look at and consider the metro area. That would be Fort Bend, Harris, Montgomery, Brazoria, and Waller. Some plans don't consider Waller as part of the metro area. Some include Galveston as part of the metro area. But the plans can dictate what counties they're going to include.
Wow.
Okay? So as we go through this, Medicare Advantage plans could be an HMO, could be a PPO. Both plans this year, you're going to see higher out-of-pockets. In other words, the most you spend in one calendar year for medical stuff is going to be higher than it has ever been before. Some of them I've seen as high this year as $9,200, $9,200.
Okay.
They're also going to have higher co-payments. You'll see that most of the plans used to charge $120 to go to the emergency room. That price has gone up to $130. Your urgent care was usually around $50 to $90. Now that's gone from $60 to up to $100. So you'll see those co-payments going up. You'll also see co-insurance amounts changing. Many of the plans used to only have a 10% co-insurance, meaning the plan's going to pay 90%, you're going to pay 10%. That's changing now to be more of a 15-20, meaning you're going to pay 15 or 20%. The plan's going to pay 85 or 80%. So once again, they're trying to be more cost conscious. And even on the PPO plans, you're going to see some cost shifting that you've not seen before. And you'll also see a lot of fixed payments changing to co-insurance amounts. So instead of having a fixed payment, now you're going to have to pay a percentage. And I'll guarantee you that percentage is going to be higher than what your fixed copay was. Any other questions you have about Medicare Advantage? Keep in mind that most of the plans have a zero to a nominal copay. I mentioned Blue Cross Blue Shield copays, premiums, because those were very surprising to me to find. Usually we see plans in 2025 that were around $18 to $24, $25. This year, I've seen plans that were $18 to $20, $25. Now they're going to $30 and $40. Granted, Blue Cross Blue Shield slid that scale up a little bit higher, but they're still out there, and there are still some zero premiums out there. Okay? So remember, open enrollment begins on October 15th, goes through December 7th. If you got your ANOC or your notice of change and they said that your plan is leaving this area, you really have until December 31st to make that change. Because your plan is exiting the market, you have an added time to change that plan. But I would not recommend waiting until December 31st because plans only begin the first of each month. So if you wait to December 31st, you're not going to have a plan ready to go January 1st. You're not going to have a card in your hand ready to go get services. You probably won't have a plan in place until somewhere around the 5th to the 7th of the next month. Okay, that's not the best, but at least you don't have a lapse in coverage. If you wait and change your plan in January, you will have a lapse in coverage. And if you have to go to the doctor from January 1st through February 1st, you will be on original Medicare only. So you'll have to pay that deductible and your out-of-pocket 20%.
Okay.
All right?
And for people who are already on a Medicare plan, whether it's Advantage or a supplement, are they having to re-sign up every year for those plans, or does it automatically keep them enrolled?
So on the supplement, that automatically keeps you enrolled.
Okay.
Until you say, stop, I don't want it anymore.
Okay.
Okay? On the Medicare Advantage plans, if your plan is not changing, meaning it's not leaving the marketplace, then you can do what we call a rollover. So you just roll over from one year to the next. But if you're not happy with the plan's changes, you're unhappy with the way they're changing the price, or you're unhappy that your doctor's out of the network, or whatever, then you do have to re-enroll. Now, each year, if you're on a supplement, this is your time, October 15th through December 7th, to get a new Part D prescription drug plan. So what the supplement folks need to pay attention to is how much has my formulary or how much has my new plan cost changed. And I say that change because there are lots of changes there. Let's talk about Part D for just a minute. In 2006, there were more than 50 insurance companies offering more than 50 plans. Most of them offered 2, possibly 3 plans. In 2024, there were 11 companies offering plans. Once again, those 11 companies offered somewhere between 2 and 3 plans apiece. 2025, this year, there were 7 companies that were offering plans. Most of them were offering 1 or 2 plans. In 2026, there will be 5 companies offering plans, and most of those companies are offering 1 or 2 plans at the most. So if you consider, we went from over 100 plans in 2006 to 20 years later having about 10 or 12 plans left.
So there's an obvious trend there. It's all cost related?
It's all cost related.
And do you
That's
see
correct.
that continuing to dwindle?
Unfortunately, yes.
Okay.
Yes.
And have these left in 2026 absorbed the prior ones
So
where they've been combined?
So it's not so much they've absorbed the prior ones, it's that people have had to find where their medications are covered. Because each company has its own formularies. And so while I may be on ABC company this year because Eliquis, the medicine I take for my heart, the name brand that I take for my heart, is covered by ABC company. Next year, ABC company may say, no, not going to cover Eliquis this year, sorry. So you have to go to XYZ company, and they're going to cover it. The other thing that's happening is there's usually 5 or 4 levels of tiers in Part D plans. What's going on now is levels 1 and 2 are going to have a fixed copay in most cases, even on Medicare Advantage plans. Levels 1 and 2 will be a fixed copay, which are your generics and preferred generics. Beginning with level or tier 3, 4, and 5, if there's a 5th tier, those are all going to be now a percentage rather than a fixed copay. Level 3, tier 3, used to be a fixed copay. Most plans are now going to have a percentage of the drug cost that you will be responsible for, rather than a $45 or a $47 copay. Once again, everything is looking at what's going on here in the market. And here in the market, we have more people getting care than ever before. So on average, in 2026, the drug plans, Part D plans, have increased $40 per month. That's on top of their regular, 5-7% increases already. The deductible for Part D has increased from $590 to $615. That's not unusual. We usually see a little bit of an increase in the deductible. We also see that the maximum out-of-pocket has increased from $2,000 to $2,100. Once again, we've always seen some sort of an increase on the out-of-pocket. So those are expected increases. What weren't expected were the $40 on top of the regular increase. And so nationally, on average, we've seen costs increase more than 7 to 10% because of this $40 average increase across the country.
And what was it prior?
We didn't see but maybe a $7 to $10 increase
Okay.
nationally. The other thing that I want to make sure everyone's aware of, there are no commissions being paid in Part D Medicare. Last year, many of the plans stopped paying commissions to agents. This year, all of the plans have stopped paying commissions. And I mean, on Part D, we were being paid somewhere between $35 and $50 one shot once a year. Even though the participant or the enrolled person was paying $40, $50, $90 a month. As an agent, we were paid a very small portion of that. This year, there are no commissions being paid. GoodRx and other discount programs are not considered credible coverage. The Canadian med stores and Canadian pharmacy, those are not considered credible coverage. So if you're using those things for your drug plan now, if you ever go to get on a Medicare Advantage or Medicare Part D plan, you will be assessed a penalty of 1% each month you have no coverage. And you think, well, that can't be so bad. I calculated a cost for a gentleman the other day. He was 74 years old when he started on Medicare at age 65. He did not get a Part D. He's been on original Medicare, very healthy individual, didn't really see the need for Medicare because he never went to the doctor. Now he's having some health issues and he has to have a surgery, and he really can't afford the surgery without Medicare. So now he's got to get on a Medicare Advantage plan because his 20% of the procedures he has to have done is well over $5,000, and he just financially can't afford that. So we had to figure out what his premium was, what his penalty was going to be. And he's going to be paying somewhere between $50 and $60 a month extra. That's his Part D penalty. Forever. Because he did not have a Part D when he first started on Medicare. And you think, $50 to $60. But you think about that, and he's 75. He could easily live to be 90 or 95. That's 20 years of $50 to $60 every month. So that's $600 potentially each year. And $600 would be the low side.
Did you say there were zero premium Part D policies or no?
I have not found one yet this year going into 2026, but that doesn't mean they're not out there. It just means that maybe here in the Metro Texas area, Metro Houston area, we don't have a Part D that's a zero premium, but there may be some out there somewhere.
Just for, I guess, those people that, let's just say there's someone out there that's using a GoodRx policy and they want to continue it. Mm-hmm. Your recommendation, I would imagine, would be like, go find the cheapest Part D you can find and just get that so you can
That's
not
right.
be penalized and still use your GoodRx on the side or whatever.
That's correct.
Okay.
Absolutely. Because GoodRx is not credible coverage.
Right.
Okay. We were talking for just a minute about commissions. So I want to make sure that all of your folks are aware of a couple of other things. It's not state secret what we're paid on Medicare Advantage plans. We're paid $321 one time, once a year, for each individual that we help enroll or that roll over, that's in what we call our book of business, or we are that person's agent of record. That means that we service that person and help them when they have problems with their claims, help them when they're having problems getting their doctor in the network, all those kinds of things. We service that client. When you're a brand new person, first turning 65, if you sign up for a Medicare Advantage, your agent is paid $624 this year. Those commission rates are set by the federal government each year, so it's not like it's a state secret. But there are many agents out there that sign people up and then don't service their account. In other words, that, oh yes, I'll be happy to help you whenever you want, and here's my card. And then January 2nd, they've turned off that phone number. And so when you're calling them using their business card, that phone is no longer in working order. Now what do you do? Because you've got no one to help you. All right? So you should have, when you talk to an agent, you should have them sign, or they should have you sign, a scope of appointment, which basically gives you permission to talk to that agent about Medicare Supplement, Medicare Advantage, Part D, whatever things. There's 5 things you can talk to them about: supplements, Part D, Advantage plans, and ancillary coverages. Sorry, there's only 4 things. And you have to check the box that you want them to talk to you about. If they want to talk to you about ancillary coverage and you only check the box for Medicare supplements or Medicare Part D, then you can say, I'm really not interested in those things, and have that conversation stop. If they don't stop that conversation and they continue, you may want to find a new agent, because they're not following the rules that have been set up to protect you as the insured. There's a lot of things going on with the plans exiting the marketplace. If you talk to an agent and they tell you, you need to sign up for this plan because blah, 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 and we're not leaving Texas. Well, great, but what if your doctor isn't in that market, or what if your doctor isn't in that network? So you want to be aware if they're trying to scare you into taking a plan because you don't want to be stuck without a Medicare Advantage plan. They will do that. There are companies out there that know who are leaving the plans and who will not have coverage, and they buy those lists and they beat the poor people to death. And you can get 6 calls from 6 different places, but because you're on that list, they know your plan is leaving the area. So don't let someone scare you into making a decision. You have from October 15th through December 7th, and if your plan is leaving, you have really until December 31st. I would not recommend you wait to the end of that period. I hate to tell people this, but start sooner rather than later. Everyone enjoys their holidays because you can sleep well knowing that you've got your medication and your Medicare all done. Beware if they're trying to scare you. You may have an agent say to you, well, because I no longer receive a commission, I'm going to charge a fee to help you with your Part D. They are breaking the law because they can lose their license for charging a fee as still receive commissions. Even though they're not receiving a commission for that particular product, the fact is they are receiving commissions from an insurance carrier for selling other products. And you cannot charge a consulting or consultation or whatever kind of fee you want to call it and still receive commissions. So if your neighbor says to you, oh, well, my agent only charged me $50 or $75, there are people out there that are charging up to $200 for finding Part D drug plans. And that is strictly against the rules. Be careful. Be sure that your agent is listening to you. Are they saying, oh yeah, your doctor's in the network, don't worry about it. Oh yeah, don't worry about it. Oh yeah. Ask them, well, can you check and see? Because, they should be able to look it up within a matter of a couple of minutes while you're either on the phone or there in their office. They should be able to search on the network and find very quickly whether or not your doctor's in or out of network. Are they checking for your specialists? If you don't want to change cardiologist, you don't have to. We just have to find a plan that's got your cardiologist in the network. Are they checking your medications? Do they tell you how your medications are going to be covered? If they're not telling you what the co-pays are or the percentage on that step tier 3 is going to be, they're probably not checking for you. Be careful. And if they keep directing you to a specific plan or company, know that they may only be able to sell one plan. When you're on a Medicare Advantage plan, there are no underwriting questions at all. So if you have some cancer or if you have something, you can get onto a Medicare Advantage plan with no medical questions asked.
So there's a benefit of
There is
Advantage.
a benefit.
Okay.
There is a benefit. Definitely.
Okay. And compared to a supplement, the price for a PPO Advantage plan compared to a supplement, it's replacing everything, right? An Advantage plan.
An Advantage plan
Yeah.
is replacing not only your medical, it's also got your Part D. Some still do have dental and some do still have vision. That dental and vision coverage is getting slimmer and slimmer, but there are still those perks out there. On the supplement side of things, you would have your supplement cost plus a Part D plus dental and vision if you want it.
Okay. So are we still finding that Advantage plans tend to be less expensive
Absolutely.
than the other side?
Absolutely. Even at the 142 with Blue Cross Blue Shield, their Medicare PPO, the most expensive one they have, is still less expensive than a supplement with a Part D,
Okay.
not including the dental or the vision.
Okay. Lots of good information. Thank you
Maybe
very much.
too much.
It's a lot to process, and it's something that I think people have to listen to over and over again. Because I think even for us who aren't in it every day like you are, we have to do that so we understand what you're talking about too. So, well, good. Well, thank you for joining us.
Thank you for your
It's
time.
great information.